Yeah, no, it's one of these moments in time. I've been working on this product for about 13 years, so I've lost a lot of my hair along the way with this program. But the vision for us is that we can democratize access with this product to patients who either are unfit for radical cystectomy, frankly don't want to undergo radical cystectomy, or really are frustrated with their inability to respond to BCG. And frankly, BCG shortage remains an issue. So patients who see the drug and may need to see it again and can't, right, in that BCG-unresponsive population as defined. The product really does fit in the urologic practice today. It's shelf stable. There's no temperature requirement. You can pull one off the shelf. If you drop it on the floor, you can grab another one. It's not bespoke or tailored to one specific patient, so you can have it in supply. It's easy for us to really kind of talk about the logistics of it, but the logistics are so important. This is an octogenarian population, right? Many of these patients are in their 7th, 8th, 9th decade of life. They're older. They may have other comorbidities. They don't really want to be in a practice for 6 hours getting an infusion. So it's become really kind of hip and cool to say democratize care across the spectrum of disease. I'd like to think that we actually can do it. And so the fact that it's able to be placed by a mid-level provider doesn't require a urologist. You don't have to be NPO at midnight. You can eat a sandwich before you come into the clinic, and the urologist or the nurse practitioner or the PA can place it and remove it. It's done at the same time as all the normal activities you would actually carry out on a patient anyway. Hey, I'm going to look inside your bladder, make sure there's no tumor that's recurred. I'm going to take out this old device, pop a new one in. It just works. So I think the vision, and it's a vision I think J&J really has done well, which is, we take a global view, we take a disease area stronghold view. We're going to live in this disease state for the next 10, 20, 30 years. And how do we make a meaningful impact now and then change the standard of care across the disease? I'll be honest, I'm very, very, it's hard for me to think of a program or portfolio that is going head to head with a standard of care such as chemoradiotherapy, BCG, addressing a population that right now has never seen a controlled study, BCG-unresponsive and exposed, Sunrise-5. That I think speaks, gives kind of truth to power of the vision that we have to make a difference. No, it's a great question. So we definitely have some other really, really interesting opportunities before us. We're really excited about the opportunity to organ preserve and bladder spare. We think we're learning every day from Sunrise-4, which we presented at ESMO just a couple months ago. There's a really nice ability to synergize with systemic checkpoint inhibition. We're really starting to see that contribution of components of each agent when they work together. We've got some really exciting things in the pipeline that might look at tumor escape mechanisms from TAR-200 that we might be able to combine with. And so I think, the world's our oyster here, where when you work at a company that has facility with antibody-drug conjugates, radioligands, targeted therapies, diagnostics, med device, med tech, pharma, there's really a kind of playground or a curse of riches. I think for us, it's being very strategic and focused on, hey, are we addressing the unmet need properly? And then, frankly, to ultimately get to things that patients can use or experience, over their lifetime, over years, so that you're not having to have them come into the clinic and change the device. Maybe it self-dissolves. So all these kind of cool ideas you might think about as kind of next generation science fiction, I think are very much things we're working on today. It's really fun to work in bladder cancer because it's been a really quiet space for a long time. I think the past 10 years have been what started a renaissance. Seeing people get really excited about bladder cancer at meetings like the SCO this week, right? People are really excited. ESMO, to have plenaries about bladder cancer at ESMO, for local disease. So I'm just excited. I think we've found a slipstream in the time where we can actually be making a meaningful difference and the world is actually listening. So we're really excited about that.